Hello, cardiovascular and pulmonary students or CVB team. This is Dr. Kamel again, and one of the new NBT style question. So let's look at today's question and see what's going on. A 54 male patient admitted to an acute care hospital is not able to attend a scheduled physical therapy session due to suspected critical limb ischemia. Which of the following symptoms is most commonly associated with this condition? Okay, somebody who is 54 years old, who was admitted to acute care hospital as a patient was not able to complete the physical therapy session. Why? Because this patient might have critical limb ischemia. What is ischemia? Ischemia is deprivation of blood supply to an organ or tissue. Okay, and if it is not treated well, it will lead to very serious consequences, like gangrene, like amputation, necrosis, stuff like that. Which of the following symptoms is most commonly associated with this condition? Is it severe pain in the legs and feet at rest, increased temperature in the lower leg and foot, bounding lower extremity peripheral pulses, flaking skin on the legs with brownish discoloration? Okay. So actually this condition is twofold. This condition is cardiovascular and integumentary at the same time, because when we are talking in the integumentary system, we differentiate between arterial versus venous ulcers. So this could be part of the question, but at the same time here we are trying to see if somebody has ischemia or low blood supply to an organ or tissue, what will happen? Okay, and the correct answer is number one, severe pain in the legs and feet at rest. Let's see why the correct is correct and why the incorrect is incorrect. Okay, so if we look at this question, critical limb ischemia means deterioration of ischemia rate, somebody who has diminished blood supply or obstruction of arteries, okay, and now markedly have a reduced blood flow to the extremity. So it is a worsening of a condition, okay. And also, ischemia could be an acute problem. So sudden obstruction happened due to embolism or something like that. So not in all cases it has to be a chronic or a progressive condition. It could happen all of a sudden. Okay. So this is somebody, if somebody have peripheral arterial disease and the case progressed and there are more buildup of plaque which narrows or blocks the blood flow further, it will result in critical limb ischemia, and this is a serious medical condition which needs the patient to go to acute care hospital, like in this case, and stop physical therapy. Usually, if there is peripheral arterial disease, if the patient sitting and dangling, his lower extremity, so the blood supply will, or the blood flow will go with gravity, so there will be some improvement. If the patient stands up and start to do some walking, so the blood flow will increase to the muscles. So this is one way, okay. But if it is severe, or there is high percentage of obstruction, it will lead to critical limb ischemia, and this will be characterized by severe pain in the legs and feet, even at rest. Okay, let's see why the other answers are not right. Increased temperature in the lower and foot. No, I would lower leg and foot. I would expect diminished temperature, not increased temperature. So when there is critical limb ischemia, there will be significant decrease in temperature of the lower legs and feet. Why? Because there is significant decrease in blood flow. Okay. Number three, bounding lower extremity peripheral pulses. I would expect is the opposite. You know, why bounding lower extremity peripheral pulses will usually happen when there is too much blood or very strong contraction of the heart. So a bounding pulse refer to a full and spring-like pulse on palpation as a result of cardiac contraction or excessive volume of circulating blood within the vascular system. So when there is critical limb ischemia, there will be absent or diminished peripheral pulse. Okay. Number four, flaking skin on the legs with brownish discoloration. No, this is usually with venous insufficiency, not arterial insufficiency. And critical limb ischemia will be characterized by shiny, smooth, dry skin on the legs or feet. So like in this picture, this is venous insufficiency. So the blood flow or the blood supply go here to distal, but does not back up from distal to proximal. So there is certain characteristics for the venous ulcer. This brownish discoloration is one of the characteristics of the venous ulcer due to hemosiderin deposition, and that's why the color is like that. But for people with arterial insufficiency, like in this case, there will be rubber there will be pallor, okay, on elevation of the limb, and this is rubber of dependency when the leg move from being against gravity to be lowered and be with gravity. So this is called rubber on off dependency, which is a sudden reddish coloration of the extremity like this after being dangled or with gravity. At the same time, this is a type of ischemic ulcer, and as I said, there will be shiny, smooth, dry skin on the legs or feet. Thank you, and I will see you in a new question soon.